Hey there. So, Corona doesn't even exist, right? It's just overhyped up and it's just a flu and it's gonna go away really quickly, right? Actually, no. That's all wrong. And I'm saying that because I went through it. So, it all started when my sister started to feel really unwell, and because she had most of the symptoms, we got her test done and she was positive. When we got to know that, it felt like a storm just struck our house. Thankfully, she recovered really quickly because she was healthy, and since she was stable, with the doctor's advice to isolate her at home, so we did that. The next day, I began to feel really weak and feverish, and I also had a cough. So I got my test done, and as expected, it was also positive. So after 2 days of home isolation, my symptoms got worse and I had a cough to a point where I couldn't breathe at all. So we rushed to the hospital and they checked my vitals, took my x-ray and blood test and all that. And at least after 4 hours of waiting, the doctor said they were going to admit me in an isolation room. I, a 14-year-old girl, was terrified, but my parents explained why it was necessary for my health to be in doctor's supervision. So after waiting 2 more hours and getting 4 needles poked into my arms, it was time to move to the isolation room. I was really scared. The corridor to the room felt like a horror movie. So at 4 a.m., when I got to my room, there was another lady in that room. She was really old and unstable, and she was attached to many machines. So at this point, I was terrified. I was on call with my dad and I was crying a lot. I felt like this time would never pass. I did not sleep all night and stayed on call with anyone possible because I was just so scared. My mom and dad were awfully worried and I was really unwell. After getting countless injections and drips, I was finally discharged after 3 days and remained in home isolation for a week. This time was extremely difficult for me and my family, and it was really hard to stay strong. I began to feel hopeless and depressed. But from this experience, I got a lot braver. I couldn't even get my blood test done without my parents by my side, but after this, I got many injections and went through it. I just have a request. Don't spread false information on the internet. It can affect someone's life and health really badly. I, who believed the virus was nothing but a flu, I didn't take it seriously at all. And I guess I learned my lesson. All those of you who were infected and who are going through a hard time, and those of you who are going into depression because of this, it's just gonna get better. It's gonna get better.
Oh my god, and we totally jumped off the cliff and had to swim all the way to shore because the dog chased us all the way to the end. Oh.
So welcome everyone. We right now have only 6 people here, and this is for Bhumika. I want to thank Bhumika for this initiative and the fact that this session will be recorded and shared with a lot of other people throughout the world. We are women professional in psychology all around the world. So it's beautiful what Bhumika is doing. And I appreciate the invitation of being here. My name is Claudia Martinez. I am a Venezuelan psychologist, and I have been living in Panama for the past 5 years. So without further presentations, I am going to talk to you about or present you to our team of professionals today. We have Ingrida Bartuke from Lithuania. I would appreciate if you put the microphones so we do not have any. I'm going to mute you for the time being, and then when it's your time to speak, then we can unmute ourselves. Okay. We have Ingrida Bartuke from Lithuania, Sue Leslie from United Kingdom. We are still waiting for Iman from Sweden, Dina from Luxembourg, Margarita Murillo from Costa Rica, and myself here from Panama. So please remember that each one of us has 3 minutes to develop our questions and answers. And then afterwards, we're going to have some time to interact and share what our experience has been about this topic. Okay, so our first question is for Ingrida, and I would like to listen to Ingrida's answer about how COVID is affecting mental health and what can be psychological first aid. Ingrida, welcome.
Thank you very much. I'll try to cover my subject and about mental health and psychological first aid. As you know, COVID, we had another SARS flu, but differently that COVID-19 has changed our life and has created a public mental health crisis. COVID-19 survivors and frontline healthcare professionals are experiencing depression and PTSD, while public is to overcome anxiety, fear, and lockdowns and psychosocial impact. Added that we now are having overall feeling of uncertainty. The enormity of living in isolation, changes in our daily lives, series of losses has the potential to affect the mental health and well-being of many. Some researchers say that public is experiencing some kind of grief stages described by Kubler-Ross. These are shock, denial, depression, negotiation, and adaptation to the loss. Without treatment, especially during physical distancing, prolonged grief increases the risk of substance use, sleep disorders, impaired immune functioning, and suicidal thinking. Depression and anxiety can coexist with prolonged grief. It's also important to know the signs of anxiety, panic attacks, depression, and suicide so we can easily identify them. In response to the coronavirus pandemic, disaster psychologists point to psychological first aid, PFA, to help people rapidly and effectively. This approach, commonly used in the aftermath of acute disasters, aims to reduce immediate distress and improve adaptive functioning in the face of a traumatic event. The difference here is that everyone is both feeling the to support others around them who are also impacted. So we are having a term mass trauma. PFA is based on an understanding that disaster survivors and others affected by such events will experience a broad range of early reactions, physical, psychological, behavioral, and some of these reactions will cause enough distress to interfere with adaptive coping, and recovery may be helped by support from compassionate and caring disaster responders. PFA core actions constitute the basic objective of providing early assistance within days or weeks following an event. Providers should be flexible and base the amount of time they spend on each core action on the survivor's specific needs and concerns, on respondents' needs and concerns as well. So, which are the 8 PFA or psychological first aid core actions or skills? They include contact and engagement to respond to contacts initiated by survivors and to initiate contacts in a non-intrusive, compassionate, and helpful manner, safety and comfort, stabilization if needed, to calm and orient emotionally overwhelmed and disoriented survivors, information gathering on current needs and concerns, practical assistance, connection with social support, including family members, friends, and community helping resources, information on coping, and linkage with collaborative services. So these are the main core psychological first aid core actions which the survivors should get. Thank you.
Thank you, Ingrida. Thank you very much. And we're going to go on to our second question, which is how to take care of your emotional care health during the COVID era? I'm going to repeat the question. How to take care of your emotional health during COVID era? Okay, since I'm going to check if Galaxy S10
That's
is...
me, Iman here.
Hey, Iman,
Hi.
welcome. Hello.
I fail to understand why my name is not there, but I was here from the beginning.
Okay,
Hello,
okay.
everyone. I hope everyone is good and handling their emotional health. So let me start with that. Okay, initially, you know what? When it comes to emotions, normally we people mix them with feelings. Like emotions and feelings are one and the same thing. Basically, it's two sides of the same coin. So emotions are something, those chemicals released in our body, but feelings are the conscious level at which we understand, okay, what's going on. So first of all, we need to understand the difference, how these two things are related and different. Emotions, that is why emotions can be catered in different way when we know they're the actual chemical reactions in our amygdala. Okay, starting with that, first of all, during COVID-19, because we are all here and stuck, some of us are stuck at home and with family members and spending a lot of time. So our eating habits are changing or have changed. Moreover, we are like not discussing stuff with our family members, what is troubling us or what is creating problems for us. So we have to be a bit assertive. It's okay to feel bad. I mean, normally people say it's not okay, but it is okay to feel bad. And then, you know, when you accept it that you're feeling bad, then you can actually help yourself out. But the first stage of acceptance of feeling bad has to be crossed. Secondly, okay, now when you talk about emotions, there's for instance, you have guilt or shame that you're not able to support the family financially. So that is coming because of the feelings you have for it, how you deal with it. Do you talk to your better half? Do you confide in your family what's troubling you? No, we don't do that. What we do is we want to protect them. We do not want to bother them with our stresses. So that is actually causing more stress to us and making it difficult for us to, you know, handle them. So if these feelings are overwhelming, it's okay. You should tell yourself in certain crises, it is okay to have such feelings, to feel bad, to feel guilty, because the moment you accept them, then you'll be able to handle them. Moreover, as far as like they were like how to look after, my question was to with your emotional health. Have you ever heard about water therapy? Like people who swim, the first thing they do is they relax their minds. And then that makes them feel relaxed and everything. So taking a bath at this time would be perfect. The body will be relaxed. And when you come out after the bath, you feel relaxed and energetic. So if you're feeling depressed or anything, you can take a bath. Moreover, you can also go for getting enough sleep. Or there was a friend of mine, she was like, we should look after our gut health. So how the gut health is, helping us. Have fruits with nutrition. That actually helps you fight back the depression and everything. So since depression, stress, anxiety, they are all coming because of the hormonal imbalance. Neurotransmitters, their functions they're not working properly. So if your food intake is good, you will be able to fight back the stress and everything. Moreover, please move your body. Stop sitting on the sofa. Move a little bit. Even walk for a while in your house. When you're talking to someone, start taking a small like walking in the room, or just going from kitchen to your room or the lounge if you have one, if you're not living in a studio apartment, and keep talking on the phone. You are exercising, you are regulating your system, and you'll feel fresh even after talking. Keep connected to people around you. Tell them. We have stopped telling people how we feel. We think being vulnerable to others would make us weak, but actually it makes us strong because we let go those emotions. And then there's nothing to hide. Then we are stronger. When we have things to hide, then we become vulnerable more. So let people in, talk to them. If you are sad, if you are depressed, if you are angry, annoyed, irritated, explain to them why it's happening to you. What is the reason? If you are assertive, you will be happier. And people who find, like me, difficult to be very assertive and talk about their feelings to others, I would rather go for writing them down and then burning the paper, believe me. Burning it, because I don't want anybody to find it. But once I've written it on the diary or on a piece of paper, how I'm feeling, how vulnerable I am, how difficult it is for me to not connect with others, not tell them what's bothering me so much, I like suddenly calms down. So for me, it works perfectly. But it's also a psychological technique to release your stress. So yeah, you can also use that. And please make sure your television news channels watching time is minimum. Once a week would be more than sufficient to have a gist of where COVID is going. Watching them and following the news with COVID-19 is only going to create a lot of anxiety. I mean, you are already following the distance theory, social distancing, not connecting much. It is not going to give you any more hope, because I don't think media is giving hope regarding that. Okay, in the morning when I open the newspaper, 10 have passed away due to COVID-19. 20 are in critical conditions. What would be my reaction? I'll freak out. I'm going to go out. What's going to happen to me? So I think once a week freaking out is okay. We can manage once a week freaking out, but not on regular basis. So we need to decrease the amount of news channels we are watching. Go for some comedy news channels or some family time or whatever you love to watch on media to relax yourself. Then please make a gratitude list. Think what you have achieved in that day. A child smiled for once. My son smiled. I had a nice laugh with my husband or my sister. At the end of the day, think what was the best about the day. Think about that instead of what you couldn't get. You will feel better. You will have a more sound sleep. And try to sleep more comparatively, not 3-4 hours, just go a little bit more. That will also help you fight back the system. Lastly, please plan. What if, let's say, what if this happens? How you can deal with it? When you have a complete plan out there, then you will worry less. Okay, I know if this is going to happen, this is how I'm going to go about it. God forbid, if I'm sick, I'm going to eat more healthy. I'm going to make my nervous system strong. I'm going to add this into my diet, and I'll be okay. And not everyone is dying with COVID-19. There are more who are getting better than the ones who are dying. We need to tell that to ourselves. So why not look at the brighter side rather than looking at the bad side? So I think, and lastly, please treat yourself well. You have time. Use all the beauty techniques which you thought you would do. Use all the diets which you planned and you couldn't cook and you couldn't do it. And dye your hair, change your look, and please ask your friends to support yourself. So that's when I work perfect. That would be all from my side. Thank you.
Thank you so much, Iman. I enjoyed very much the answer to your question. Thank you so much.
You're welcome.
Okay. And our question number 3 is how to, excuse me, I went by Sue. So question number 2 was, what are the healthy ways to cope with stress during COVID? Sue from United Kingdom, welcome.
Hi. Firstly, thank you for inviting me to join this. I feel really honoured and it's such a privilege. I'm very conscious that a lot of the information that I was going to speak about is overlapping. So I am going to keep to my 3 minutes and just highlight the elements that I had decided I was going to bring to the conversation. So again, I think firstly I'd like to say that we need to acknowledge that stress is a normal response, and it's okay. It's really okay to feel, you know, confused, scared, anxious during a crisis. We all are. And we all have different ways of presenting stress. Some of us, you know, show stress, some of us don't. And I think sometimes we compare ourselves to others, and we have to recognize that everybody has different levels of stress. One of the things that I feel is most important is about connection with others. You know, as said previously, I think we do tend to suppress our thoughts and feelings, and this is something that we really need to share amongst others. We're all experiencing this around the world. It's very rarely that we have something that we're all connected in such a way with such an awful situation. The one thing that I would say is it depends on where you are and what's available to you. So it's initially I suggest that people do the research and find you know, as much as they can about what resources are available for them on their, you know, within their own community to access these places. You know, if it's support networks or our you know, our faith-based communities, to be in touch with people and have a kind of safe plan, so that if we do feel we need to reach out, we know who to reach out to, and we have those contact details you know, available to us. I will briefly touch on, like what we'd said before, it's important that we still take care of our health and try and maintain, you know, the healthy eating and exercise, and even people who are restricted with movement, it is just about, you know, doing the little things that you can to distract you from just sitting and worrying. And I think, again, it's very much being aware of misinformation as well. If we do listen to social media and such like, we have to be very careful that we are getting the right information, because a lot of things can be scaremongering, and our stress levels will go up. So yes, monitor your time that you spend with social media and what you were actually engaging with. Another thing that happens when we're stressed, we tend to go for support from the wrong things, you know, alcohol, smoking, and this is natural to do that, but we must be aware that, you know, reaching out to the wrong drugs and the wrong, you know, drinking too much or smoking too much, it actually raises our stress levels. We think that it is helping us, but it is in fact raising our stress levels. So just be mindful, you know, and again, if this is an issue that you feel is impacting on you, please get the right support, find out who can help you with this during this awful period. The other thing that I was wanting to say is, in the past, we will have been stressed through with different things in our life, and we will have developed coping strategies that have been useful for us to use. And I think it's to reflect on what we have found useful in the past, and to you know, get in touch with those things, as said, like mindfulness and really taking that extra self-care, because quite often we do think of others and we worry about others and we put ourselves last. So yes, so to reinforce that self-care and that kindness. I think I'm going to leave it there, because like I say, I don't want to overlap on our other experts. Thank you.
Thank you so very much, Sue. And it was excellent, and definitely being aware of the amount of stress that we are dealing with is going to help us to impact others in a positive way. Question number 4 is how to cope with isolation and quarantine. And for that, we have Dina from Luxembourg. Welcome, Dina.
You listen to me? Okay.
Yes, perfectly now.
Okay. I think my answers have a link with the other intervenants, but I will tell you what I was thinking about. I thought about music because for myself also it helped me. Music, it calms and it makes happy. So some researchers, they make studies about this, and they told that it provokes certain universal emotions. And one of the researchers was Alan Cohen from the California University, Berkeley. And they found out that there are 13 emotions. There are positive and negative emotions. So during COVID, I think it is better to focus on the positive emotions. So they found out that there is beauty, dreaming, joy, fun when we listen to specific music. So the other method to cope with isolation during COVID is nostalgia therapy. So that's the idea that there is an existential function and it gives meaning. So we have the idea that the past does good to the brain and the memories do good to the brain. So some studies in London in 2019, they found out that nostalgia reinforces a feeling of auto-continuity and the sensation of a red line in life, so that you have the feeling that you continue in life. And this gives you a kind of confidence and security in yourself. And also it gives a sense in life and it reinforces the social connections. Also then another idea is in the nostalgia therapy is also the positive memories. So this helps to cope better in difficult times. So when you see some pictures of positive moments in your life, so it makes that you think about these positive moments, even if you are in adverse times right now. And there is also another study from 2013 from Winnie Xuang, I think it's Chinese, but I'm not sure. So they make two group of participants, sorry. One, they expose them to sentimental memories, the other to ordinary memories. And for the sentimental memories, there was immediately an impact with optimism for the events after, you know. So there was immediately a satisfaction about their own life. And in the other group, there was not this effect. And this was an American psychologist, Clay Routledge from University of Dakota in 2011 that made this study. And then there is another Belgian psychiatrist and psychologist, Martin de Sale. He says that nostalgia stimulates resilience. So for him, the past is then digested. Nostalgia is an emotion which can be shared, communicated to others. And it's not like melancholy that is a rather solitary feeling, emotion. And this is interesting to say also that a Japanese scientist, Yoshiaki Kikuchi and Madoka Noriyushi, they find out that there is a pleasure circuit in the brain for the memories that have a positive impact on the brain with the positive emotions. So they found out that with the impact from the emotions to the brain, that we feel that the life really matters. And also that personality traits important for us during years. And then another researcher, James Bonus, University of Ohio in 2018, he compares ourselves now to the person we were. And the music, when we listen to music from the past, from the childhood, for example, we think about the person we were and the person we are now, and then this difference is rather positive, and we feel satisfied with the person we are now. So that was James Bonus that find this out with his study. I think for the nostalgia therapy is all. Then I have yoga is also a good method to cope with isolation. I think it improves sleep, it makes you happier, it helps focus, it gives inner strength. There are also a lot of benefits for the health, physical health, like heart benefits, and it protects the spine, but also psychological benefits. We have a better body image, and if we do it virtual now, maybe some can only do it virtual because they can't go out. We can also do it, for example, like with Adrienne, Yoga with Adrienne in YouTube. It's an American entrepreneur, and she does yoga classes. And then we feel less isolated when we do this. And also with the virtual meets like this, we feel less isolated. So, okay, thanks.
Thank you, Dina. And thank you for bringing up the nostalgia therapy approach, because I have to say that in my mind, I had a misconception of nostalgia as something negative and saddening, and it actually brought me a beautiful approach of remembering the good and differentiating from nostalgia from melancholy. So thank you very much, as well as all of you that have, I will try not to speak too much, but listening to you has brought me a lot of enlightenments, and like, wow, this is so interesting. And it's obvious that we come from different parts of the world. So I'm really enjoying this meeting. Okay, question number 5 is how to help children and aged in their mental health. And for that, we have Margarita Murillo from Costa Rica. Welcome, Margarita.
Thank you very much, every one of you. I'm going to bring you first a big hug from here, a big kiss, because it's necessary. And when we are talking about mental health in anybody, we need the social interaction, we need the skin, we need the kiss, and that's I think the principal problem with this COVID isolation situation. And thank you also for the initiative to share and meet with all around the world. And remember that we humans are beings of love, having a human experience. And this is very important because we make a big evolution to get the love. If we want to maintain mental health, we need social interaction and connection with our body. And we must improve technological skills. This is very important because if the children are so small, they don't have abilities yet. So you have to connect it with the grandparents, with the uncles, with everybody. And with the old people, the aged people, you have to teach them because they are not used, or they are during the last time. Now they are also my mom is 84, and she have a lot of meetings groups every week, and now they are connected with Zoom. So we must improve technological skills to maintain the connection with the people that you love or you want just to know. My mom have 3 boyfriends. So she has a different boyfriend for each situation. We love as well as open our space for interaction, and we need recreation. Remember that the recreation, this is not games, this is not play, it's recreation. What does mean recreation? Recreation means create, creative, creative. And when I say we are teaching to practice also with this recreation, meditation. And I'm sharing now all the experience because I'm a professor at the university and I teach teachers that will be a teacher. So we have a special course names, it's Education for Health and Quality of Life. So that I am sharing all the experience with my kids. I call them kids. To write stories, for example, this is a very nice, they have to write these stories or stories from what they feel and are living. Try to celebrate from a distance, from bringing music outside the homes and of the elderly because they are suffering for a lot of depression, especially the aged people. The children are feeling our fears. We are teaching to face to uncertainty. Do you understand what is uncertainty?
Yes.
That means that we live and exist with this condition. And what does mean? That you need to accept it. Creating new routines, but you have to be now and right. Have to learn to be now and exactly right now. You have to be conscious about to be I'm now. The only thing that I have is now. I don't know what's going on in 10 minutes or in 5 minutes. And try to connect it with this. Because if you connect it with the future, you will be very anxious. If you connect it with the past, you will be very depressed. And of course, you have to incorporate in the space for physical exercise. Go out with all the sanitary measures, but you have to get sun. You have to walk, you have to talk. Writing stories about what they're feeling. And with the small children, they just try to talk about. You, all of you, talking about connected with the feelings. You have to, and be conscious of that. Our experience here is tried to all these age groups that they are connecting every week, try to connect it in the same routines. And then connected with their families because they are very alone, very, very alone. And in the institutes and the places that they're living, nobody is going to visit them because it's impossible. It's very dangerous. So they created many fantastic meetings with the television and many people singing or making a serenata outside of the institutions and things like that. So I invite all of you that remember that we have, the love is our condition and we need to improve with the communication skills, technological abilities, and of course to try to be connected and try to be clear when you talk. And we try to say, okay, I'm here, I want to hug all of you and try to feel. And with the meditation, it's an ability that they got it to try to connect with their bodies, to try to be conscious for right now and what's happening exactly now. That's it.
Thank you, Margarita. Thank you so very much for your intervention and your answers. And it would be my turn to speak a little bit about how COVID can affect mental health patients. So the same as with all of us, some of my information has already been answered, but I am here speaking about sleeping disorders, eating disorders, substance abuse, worsening chronic conditions, anxiety and depression, of course. And there are aspects of the COVID-19 pandemic that relate directly and influence directly mental illnesses like isolation and loneliness, job loss, the social distancing, access, as Sue was expressing, to mental health services. So I'm going to try to be as brief as possible, but give you a little bit of information. Older adults, as Margarita was saying, are reporting negative mental health impacts, an increase since March. women with children under the age of 18 are more likely to report negative mental health impacts than male counterparts. Job loss is associated with an increase in depression, anxiety, distress, low self-esteem, and unfortunately may lead to higher rates of substance abuse, as Sue was expressing, and suicidal ideations and attempts. All of this has been happening, and I wish I could bring more encouraging information. And Iman gave us a very beautiful set of skills, as well as all of you have. Adolescents have increased their number or reports of a major depressed suicide in the past year, and drug overdoses, as well as suicide. During these unprecedented times, all of what I have been speaking has been exacerbated, unfortunately. So epidemics have shown to induce general stress according to the population. And it is important for us as mental health care professionals to share as much as we can the positive side of this reality, because what I'm speaking right now is true, is real, but it's part of the reality. We also have a lot of initiatives that are working for the better. Okay, so the COVID-19 pandemic has led as well for millions of job losses, and many countries are declaring economic recession. Some considerations that the World Health Organization has done is incorporating mental health in the national, in different countries, in the national COVID-19 responses, so that increases mental health care throughout telecommunications or online services. And that is an improvement, but yet we have to think about the many, many people that do not have access to internet, okay? Of course, we have had an increasing amount of social media and social networks that are delivering positive information about COVID-19. So we have to keep in mind for people with mental health illnesses to assess them and direct them to the right information instead of feeling overloaded with negative information. Unfortunately, the pandemic is very likely to have long and low and short term implications on mental health patients. For example, imagine a person with health anxiety. It's like the worst case scenario come true. So handling mental health patients, it is delicate, it's very important, and it requires all of us to be upfront and firsthand available, okay? Psychological distress, and as I forgot, give me 1 second, Ingrida, as Ingrida was expressing to us, trauma unfortunately can have a lasting for almost 3 years in some occasions, and of course depending on how much help and processing time the patient has, okay? Fortunately, emotional support hotlines are all over, and it is imperative that us in our countries and in our communities have that information available to share. So if you have a phone, at least you can contact a person throughout the phone, or someone within your small community and your small range can help others with mental care and mental health issues and clinical patients. One of the main problems that have been occurring as well is the availability to medication, both because of the loss of incomes, and medications, if not by an insurance policy, are very, very expensive, or the actual capability of going to therapy and going to mental health professional control. Okay. Many people are skipping and delaying these processes because of their condition, their economical condition, and that has led to their mental situation, to an emotional one, to worsen. In some areas, there is a lack of internet or lack of networking options. So this limits the idea of resources that the person with the mental condition has and with their families. So it's really, really important to assess that and provide as much as we can. Of course, mental health professionals are living the burnout syndrome as well. And I am trying to wrap up with Iman's intervention of taking care of ourselves and our emotions. And that is my answer for this question, but I really want to highlight the realization of nostalgia therapy done by Dina. Thank you very much. Ingrida, when she spoke about post-traumatic stress and trauma, because sometimes when you're in a different part of the country, of a country, you can listen to your particular news and not necessarily relate, as Sue was saying, about something that is so broad that involves us all. So keeping perspective of what is going on in a positive way, but also realistic throughout the world is extremely, extremely important. And I appreciate all of you in your interventions. If you want to activate your microphones if you have a question or something that really impacted you among the meeting, you're welcome to join and speak again. And thank you very much to Bhumika again and the International Women in Psychology, because I'm very thrilled of being here today thanks to that.
It's
Yes,
been to get a understanding of how other people are coping, like you say, in different countries, and how the effects are different on every single one of us.
If to say about Lithuania, so yes, I saw many who really experience much fear and anxiety, especially to be infected by COVID virus. But Lithuanians, they have some resilience, so we were not so much affected. Just most of all, we were affected that we have to listen to some kinds of instructions, but we could, for example, as a country, act like Sweden, Scandinavian countries. Sure, they have more cases of infections. And as for me, I had to work much more, so just I forgot that we're having a COVID-19. So some amount of work, just I forgot about these all things.
The one thing that I've experienced in my work is the lack of face-to-face connection, which has really affected me as a worker. So what was being said about the aged and people who were so isolated, you really feel how that must be impacting on their emotional and mental health. It's really, really worrying for the future.
And I'm learning that this will be probably more than a year. So you have to be used that this is a new way to live. For example, I think, and I would like to send letters again.
Yeah.
Send letters again that you have to write, because it's beautiful when you receive a letter that someone's write to you, like in the last time. Remember that WhatsApp doesn't exist. And you have, when I teach with my patients, I say, write a letter for your son, for your grandpa, for everybody, and send with flowers, for example, because we have delivery everywhere. You receive a delivery for fruits, for vegetables, and you help each other with the economy, because we are very worried about lost jobs, lost family, and every day is that time. It's people dying, and you don't have the opportunity to be there, or to hug there, or to talk there. And this is the hard part, because usually, at least in Latin America, when someone died, you stay together for 8 days. Every day you pray, you talk, you drink coffee and an extra alcohol or something like that, but you share the time for 9 days. This is the tradition. And what happened today? It's impossible. So we created and some other routines, but like that, and you stay every day and you pray together, but you send letters. And I think this is the most beautiful thing. Remember some small things that we were used to do in the last
Comes
time.
back to nostalgia again.
Exactly.
Yes.
But in the positive way, you just enjoy it, but try to express and say, I have the same feelings. We are humans, and like used to, when you say stress is not the problem, it's the way that you are hanging or talking about that. You have to talk about your feelings, like Ingrid said. You have to say, I'm fear. That's no problem. I am vulnerable. That's no problem. This is beautiful, because you have to go through this, because it's the only thing, or the only way to get it smart and creative and answer and everything. We have to reinvent and create new places and ways to meet each other. I think the serenata will be beautiful.
Serenata.
You know what serenata? It's like Mexico. And they say, you will love you, and they singing outside of your homes. We're doing. It's lovely.
Yeah.
And you feel close each other.
Yeah, thank you.
In Panama, it has been one of the most extreme countries in lockdowns. We were locked down for months, strictly, very, very strictly. And of course, my online work went up, and I have been very, very busy, but still living on firsthand the lack of sun, the lack of exercise. Although we managed to, as a family, do as much exercise online as we could, and I don't know, push-ups, sit-ups, anything that could keep us active and speaking. I do notice after this meeting that I did tend to not speak about my fears with my children. So it's interesting. It's interesting that we're doing the best that we can, but unless I had shared with you today, I wouldn't have noticed that I was keeping my emotions to myself a lot. So thank you very much, all of you. Welcome, Dr. Laquanda Jefferson, for being here. And I think that is it for today. We're in Panamanian time, 10:56. So we have been good with our timing. And well, thank you so very much for sharing today. It's been a real pleasure, and thanks for meeting you all in different parts of the world.
Thank you. It's been a pleasure.
Thank you very much.
A big hug and
Thanks for connecting.
Bye.
Bye-bye.
Bye.